Hey guys, welcome back to another episode of the Altmed podcast. So I'm getting a bit excited about this one. I've got my trusty co-host with me, as always, Mitchell Kurtz. He's in the house. Well, he's in his house, I should say, his apartment. And we have also joining us today the general manager of CA Clinics. It is Dolly Shukla. Dolly, welcome to the show.
Thank you.
Great to have you with us. We've got so much to talk to you about. So maybe, everyone's got a bit of an interesting story, how they ended up working in medical cannabis, and yours is no exception, I'm sure. Can you take us through what your background is and how you got into this space?
Yep, sure. So I've got working experience in medical industry for over 16 years. I started as a very junior role and, progressed in the role. Majority of my work experience is in the hospital. So I worked in the hospital for about 12, 13 years. Then I worked in primary care. Got an experience pretty much in everywhere that I can think of. I worked in inpatient, outpatient wards, pretty much any organ that you can think of. So I had good idea of, how it feels working in these industries, but I never had any exposure at all to, how it feels working with cannabis clinics. And this opportunity came about mid last year, and I was actually looking to work in something different, something challenging, something that's alternative therapy that can change people's life. And I applied for that job, and a team who's the owner of the company, who was quite impressed with it. And so I joined SCA Clinics. It is quite interesting to see, how we changing people's life with the alternative therapy that's we've been providing, that's medical cannabis.
Yeah, amazing. It's there's quite a few people that have that experience, I think, when they come from other areas of the medical profession. Unfortunately, there's some people working in this industry that have no medical background, enter Andrew and myself. But it is always good to have people that actually understand.
Yeah, I mean, someone would have some personal story behind it, and that's how they joined cannabis industry. With me, it was more of working in a different industry and sort of making more all around myself. And when I looked at it now, I look at and treat patients, and I feel very emotional that how we making difference in each and every single patient's life these days. When we get thank yous from patients and family members, it feels pretty good that, we're actually doing something. I never felt that way before working in the hospital. I never felt that way in a primary care at all. I felt like working in a business rather than, making some difference in people's life.
And it's amazing to think about how many people have missed out on this over the years, when it could have really just been such a help, for the last, for at least the last 100 years, if not.
Yeah, more than that.
Yeah, exactly. So, but I mean, I know that you have a little bit of an interest in how things came to be in Australia as well, in terms of the regulation.
Yeah.
Was that something that you were interested in chatting about?
Yeah, well, look, the regulations are there, but, more about, I would want to, get these regulations get eased a little bit, if they can, so that we can treat more patients. At the moment, regulations are quite tight. Yeah.
Yeah. What do you think in specifically could be an improvement from your perspective, being a medical professional in the field?
Look, at the moment, the process is quite slow. The TGA approvals are quite slow. The DVA approvals are quite slow. We do have a lot of DVA patients, and we feel that we could treat them faster and very efficiently if the government process was a bit efficient. I understand they have their, enough time, they've got workload, but if the approval process was faster enough, rather than waiting for 2 months for the approval to come when patient can die. There are a lot of DVA patients who are suicidal. There are a lot of patients, DVA patients particularly, who's got severe chronic pain and trauma. So if I want to treat those patients, but we can't prescribe any medications until we get the approval from DVA. So I feel that the approval process can be a little bit faster than what it is right now.
That's crazy.
Okay.
I must admit, I wasn't aware that DVA processing time was that long, because I know that patients that I've spoken to who are taking medical cannabis talk about, I think the speed at which the TGA has improved, but that is insane to think that there are veterans out there who are waiting all that time for potentially life-saving treatment options. I'm really. So you were saying, I think before we jumped on to the episode, speaking beforehand, that a lot of your work comes from managing complex cases and really probably don't let me describe it actually. Can you maybe give me a background or an overview of the types of cases the patients that you're seeing and what kind of therapy options are available for them?
Yeah, so the type of patients, basically whoever it has chronic illness, whether it's cancer patients who are taking chemotherapy, radiation therapy, patient who has severe trauma, PTSD, depression, severe anxiety, severe pain, patient who has been going through really bad headache for 15, 17 years. So we've had these kind of patients, basically someone who's suffering badly, who tried many painkillers, who tried several drugs, but they would have some impact of those drugs, but not sort of relaxing, soothing feeling, that you get with medical cannabis treatments. And those kind of patients that we treat, DVA is one of my favorite parts, because I feel that, those patients have gone through hell in their life, and, they also have gone through trauma, severe pain, anxiety, depression, and they scream. When some of the patients that I've handled, they literally, not just them, the partner is also screaming and asking for help when the medications are not being prescribed on time. So, and that's purely because of the approval process. So these kind of patients we treat at the moment, and every single patient that we've treated at CA Clinic so far are very happy and sort of thanking us and doctors for changing their life.
And when you're talking about those major indications, I guess, what are they usually presenting all together, or is it something that you would treat people for, mental illness specifically, or are you kind of taking a holistic approach to do PTSD plus pain plus a range of medicines? Do you keep them on some painkillers? Do you take them completely off? What's a little bit of the process?
Okay. I'm not a doctor, so I'm not allowed to say anything on the clinical side. But we do. So the journey starts with a screening patient, identifying if patient is really fitting to medical cannabis treatment or not. Mm-hmm. Once that gets screened, it goes to the next level, that is having a consultation with the doctor. And when doctor consults, doctor, suggests some medications. So sometimes it depending on the doctor. So sometimes patients do try to not have painkillers and have medical cannabis. Some patients do have side effects from medical cannabis, but they go away within a week. And side effects we're talking about, sometimes they feel super dizzy if they're not used to it, or they find a little bit of vomiting, nauseating, those kind of side effects they feel. So initially when they start the treatment, I don't think so they can go off completely from those painkillers, but slowly they would want to, and they're happy to get rid of those painkillers, because they feel the reason why another reason why they come to us, because they feel that in longer term painkillers do have side effects and they stop working, whereas cannabis, I'm sure you guys know as well, medical cannabis treatments or medical cannabis products, they don't have side effects, number one, major side effects. Number two, they work the same no matter on the first day or the last day.
Mm.
I mean, there is some, there is some tolerance that's built up with THC. We do see that. And I think that, some people, especially THC tends to have, if, you're talking about side effects, that's the one that has much more, we see coming, or some, I'm interested. So do you see patients, with PTSD or anxiety come through on THC medications as well? Because be interested to know that that's a common thing.
Yeah, so they do, doctors do prescribe THC to PTSD and severe anxiety. We're talking someone who has got mild anxiety. That's again, assessed by the doctor. And if doctor thinks that this patient, they will start at a lower dose of CBD oil, and then slowly they will gradually, if patient is not getting better, because we have to make sure that these patients are not getting addicted as well to these drugs, because the purpose is to treat patients, so doctors do start with CBD oil, those who has mild anxiety, but those who has severe anxiety and PTSD, yes, they do start with THC.
And have you had, I'm just curious, when you see someone, for example, who comes to the clinic that maybe has, been on opioids or heavy duty pain medicine for a while, have you found that, because you have specialist pain clinics from which some of these patients might have come from. And we know that not all, but some doctors in that field do not believe in medical cannabis. Those doctors are clearly not seeing the research that's out there. But anyway, have you experienced resistance from some of the doctors that your clinic doctors are working with?
Well, look, I do have one particular doctor. So we do have specialists, various different types of specialists, and pain specialist is my number one priority to hire at the moment. And I have one specialist, who does not believe in partially, but still wants to work at CA clinics. And that's purely, and it's very interesting because the way how he joined us, he was a patient of ours to get medical treatment who did not believe in medical cannabis treatments at all. And then he became a doctor of ours. So, we do get a little bit of pushback from these doctors, and they still they're working in medical cannabis clinics. They still want to prescribe painkillers. They still want to prescribe non-medical cannabis medications, and it's a no-no. And obviously, I would say 2% or 3%, not major pushback.
Interesting. And what kind of product formats are you seeing, especially in DVA patients? Is it more geared towards flower or oils or capsules or vapes?
Flowers and vapes are more popular with DVA patients. Basically, at the end, they get funded as well. As you may know, that DVA products get funded by DVA. So flowers are very popular in DVA patients. I would say not just DVA patients, any patients who and also cancer patients, neurological patients as well. They're
definitely big cohorts. I mean, it makes sense. It's probably flowers, the age-old format, right? It's been around for thousands of years. It's been there since Ayurvedic. It makes.
I'm sure they have tried it before even getting it legally. They've tried before 2016. They would have tried it from the black market. Poor thing, they had no option but to get, some sort of help.
Yeah, absolutely.
Yeah.
And is that, how is a patient looked at if they do come from the black market? Is it usually looked? It's a question we hear a lot. Should I tell the doctor that I've been taking black market cannabis or not? Is it like, will I get in trouble? Will it help me get a script? Or if I tell them that this works for me, how's it received from the clinic side of things?
So we do get a lot of queries, especially I would say complaint, and that's again to do with DVA approving process that's delaying, and they are the mainly DVA patients who always threat us saying that, well, just to let you know, before coming to you guys, I was getting my products from black market, and I'm going to go to black markets again. And if cops stops me for any reason, I'm going to tell CA clinics about that CA clinic is not giving me my medications, and I'm going back to black market. So we do get a lot, and I would say majority of them are, because TGA products gets approved within 24 to 48 hours, so that's not a problem. But DVA are the one who usually go to black market a lot.
Yeah, and it's a pretty timely question as well, just because I think more and more people are switching from black market to legal products. There was some research done, I think it was last year or the year before, by the Lambert Initiative at Sydney Uni, suggesting that, fewer than 5% of medical cannabis users are actually obtaining it legally. And so, for a lot of people, obviously price is a factor, but even
I was going to say that.
Yeah. Do you think, because from what I hear about pricing of CBD oils on the black market, on the internet, and the price of people just buying cannabis flower black market, it doesn't really seem like there's much of an advantage there anymore for the black market dealers. And in some cases, they're much more expensive than legal products.
Yeah.
Is that your experience?
Yes, we do. Our products, or not our products, medical cannabis products are very expensive. It's not, obviously DVA patients do get funded 100%, but they can cost you anywhere from $200 to $4,000, $5,000. So they're not cheap products at all. So that there is one more other reason again, but we're talking about, it's not going to give you the same benefits. It's not going to give you the same treatment or the result that you would get with the medical cannabis products that we prescribe to these patients. But it is very costly.
I have to say, if I was a doctor, and in case it's not abundantly obvious, I most certainly am not a doctor. But if I was, and somebody came to me and said, Dr. Dowling, I've been taking.
It's got a ring to it.
Does it have a ring? Bit of alliteration. Dr. Dowling, I've been taking some CBD oil black market. The first thing I'd say is, are you sure? Because so much of what people, somebody could have just been sold some sunflower oil, or you know what I mean? There's just absolutely no way to verify when it's black market. And I do say this to people, I'm not, again, if somebody has a cannabis medicine that's working for them, I'm not going to tell them where and from who they should get it. But yeah, I definitely think that the attraction, obviously, with obtaining legal products, especially now at a point where it's very competitive with black market and often cheaper, is that what you're going to get. And obviously that's helpful for a prescribing doctor so that they can properly dose for a patient. But it's also just good for a patient to learn more about what it is that they're actually taking and what their tolerance is.
Exactly. So that's the main thing. You don't just go to medical cannabis clinics just for the marijuana products. You do get a proper education. You do get taught when to take, what amount to take, what to expect. So there's a proper education with each consultation that goes in with them. It's not just they come to and say, hey, I want marijuana, give me marijuana. So it's not that. So but still black market is there. I'm really hoping. I was the other day watching this insight on SBS
about illegal medicine or something. I think
it was about psychedelic treatments, and I was watching that, and it was very interesting to watch that show. Very emotional. Every single patient that was in that room started somewhere through black market and now became a patient of medical cannabis clinic, but they started somewhere and they had to go through that channel of black market purely because they couldn't get help. But then now when they're getting professional help, they're appreciating that help because, they're getting proper education about it, and they pretty much very happy. Not only that, they're keeping track of their medications. Black market patients not gonna, these people not gonna know when to take, when is it due, is it monthly, can I take, we do see people dying because of overdosing as well. So all these things is to protect people, save people, and educate people, and hopefully, make huge difference in their life.
Yeah. One of the things, though, that just kind of returning to this holistic perspective, and it's something we've grappled with and sort of spoken about, I think, previously on the shows, but it's this idea that, so I was overseas not too long, or back in April, a few weeks ago, and I could see CBD oil available at pharmacies and all of this. And
on the counter.
yeah, not even over the counter where you have to present your driver's license or something like this, which is potentially what it will look like in Australia. It was literally on the shelf next to,
Wow.
cod liver oil and all the supplements and all that sort of thing. And it just got me thinking, this is clearly being marketed to people for well-being. This isn't somebody going to a doctor and saying, I have a problem. I've got, pain, sleep disorder, anxiety. I need help. This is somebody just incorporating CBD oil into their daily routine, maybe with vitamins or something else.
Yeah.
And it's just amazing. I think that in Australia, we have been boxed into thinking about it as a prescription-only medicine that requires a doctor's intervention.
Requires TGA approval.
Requires all these things, right?
Yeah.
And, I'm not here to promote the use or supply of it in the way that I talk about it, but I'm just making the observation that from a regulatory standpoint, Australia's approach is not aligned with other parts of the world. And I know that might seem obvious, but I really do wish that the regulators would actually take stock of what the outcomes are for people in countries around the world. If CBD oil has such a low chance of causing any harm or side effects, then is it really appropriate that we have it as a Schedule 4 at the moment, or even a Schedule 3?
3. It will be S3. Eventually, you will be able to get it over the counter, but not as yet. I would say, people are doing research, and obviously Australia is doing extra. Whenever we do research, we sort of do go extra mile forward, and we will be able to get it in about 2 years.
Yeah. I mean, I think of it like, I know this might seem crazy, but I think a cup of coffee actually has potentially more side effects than a dose of CBD. You know what I mean?
Low dose of CBD oil. Yeah.
Yeah. And how easy is it to go and get a cup of coffee? But, so anyway, sorry, that was just an observation while I was there. I just realized the rest of the world is doing it very differently. But yeah.
Which country was this? Can I ask?
Yeah, sure. So UK, France, I don't recall seeing it in Italy, but it probably was there. And Netherlands. Well,
they had it many years ago. They started selling it on in the pharmacy or over the counter many years ago. So we will get there. We'll definitely get there. So, but not any soon.
Absolutely. And so, what's in terms of I guess the broader, you were talking about that show with psychedelics, is that an area that CA clinics might expand into, or is it just for the time being the kind of the scope of alternative medicines being offered at CA clinics is just medical cannabis for the time being?
For the time being, we will be looking into that, but at the moment, purely medical cannabis products.
Okay, no, excellent. Yeah. And I'm I hope I haven't misunderstood. So it's to be a patient at CA clinics, it's more that you're seeing the complex cases, but CA clinics services everyone, right? So you could be just somebody who's having a little bit of difficulty sleeping, and you can speak to a doctor. You don't need to be, in a more severe or serious illness in order to? No. Okay.
So we do screen patients. We don't want the reason behind it. We don't want just to treat any patient to every patient on the road. We want to make sure that we're actually helping people who need help. And having said that, we do have a sister company called CA Connect, and which over there you can get a low dose of CBD oil over there. For that, you don't need any GP referral letter. You still get a professional practitioner consultation first and education done before you get the medication prescribed to you. So for those categories are someone who can't sleep, someone who has a little bit of headache, someone who has mild anxiety, and so maybe early stage of anxiety, we treat those patients with low dose of CBD oil. And if those patients can't get treated with those products, then they get referred straight to CA clinics.
Right. Okay. Well, that seems like a sensible approach. And I assume then, yeah, if a patient is presenting with more milder symptoms, the extent of backgrounding all of the facets of a patient's information and details is probably less. But I imagine the patients that you're dealing with in your sphere are, many years trying lots of different prescriptions and that sort of thing.
Correct. Yeah. I would say chronically ill, and every patient that I have, we've got 15,000 patients or more than 15,000 active patients, but patients that I have dealt with myself personally have gone through, and when they come to me, they're usually in tears, and that's purely because they need help. They've gone everywhere, they could not find help, and sometimes partner is ringing and telling me, my wife is dying, can you please help? I just want her to die peacefully. So it is quite, I started as a challenge CA clinics, and now it has become very personal to me because I sort of feel that I'm making huge difference in people's life.
Well, I did actually, and we obviously have to be sensitive to, patient doctor confidentiality. So I don't, but can you, maybe at a very kind of high level, give a description of, some of the types of patient outcomes that you've seen, obviously, without disclosing anything
Sure.
that would identify someone, but I'd be very interested to hear about some of these patient journeys where you're obviously really, the clinic is really making a difference.
Sure. So I had a patient who was, I wouldn't say much, so cancer patient, and last stage cancer patient, is on chemotherapy and some other therapies as well. That therapy is making the patient completely sick. That patient is in a lot of pain and mother comes to me and asking for help. And we've within 2 months, not even within 2 months, I would say within 2 weeks, patient started feeling the result. Patient could walk, patient could talk, patient could sort of enjoying and living the life, and that was a result within 2-3 weeks. And that patient's mother was so satisfied that patient started finally this journey with us. DVA patients, they come very angry, very, very, sick, complaining about their pain and their trauma that they've gone through, all the veterans patients, I would say, for that sake. And they come complaining about, I don't think so you can do anything. My pain is terrible. I wake up with nightmares. I wake up with some horrible nightmares that I'm going to die. And within 4 or 5 weeks, they actually living their life. They're spending time with their friends. They were the one who would just not get out of the bed. And they're the patient we're talking about within 5 weeks, 6 weeks of time, this treatment with medical cannabis at CA clinics. They actually enjoying their social life, talking to other people. They're going out and enjoying the actual life that they do deserve.
That's great. I love to hear that. And I can understand as well, there's been a lot of talk in the media, I think, recently just about, the treatment generally of veterans and whether the government is really providing enough support to them. And I can imagine, there's a lot of frustration there and then you have to.
The reason why these patients do feel frustrated because they feel that no one wants to treat DVA patients. And I personally, NCA clinics as well, welcome every single DVA patient out there. These DVA patients get refused by so many clinics out there. And, we do not want to refuse or turn them away at all because I know what pain they've gone through. So,
it's not just price. Like, people forget that access is one of the biggest issues. It's not even, I mean, there's price, there's access. People don't even know that it's available as a treatment. When I take it, we take it for granted because we're in the industry all the time and speaking to people and all this, but sometimes you meet somebody and say, you're working in the cannabis industry, and they're like, what, is that legal? And I'm like, yes.
Yes. You see, when I started, and this is a bit funny, when I started this job, so I'm very vocal in LinkedIn, right? And because of my job, I had to be very proactive on LinkedIn. And when I started this job, again, I started as a challenge. I did not see the actual inside of it. For me, it was like a tick box that I wanted to tick, that I've worked in every single area, but I did not work in cannabis. And if I can work in cannabis, I can prove that I'm an all-rounder. But now I'm very proud that I'm working in medical cannabis, and I can tell anyone out there that what difference we're making in people's life.
So it was just a test at the start.
It was. I took it as a challenge. I did not tell or share with anyone that I'm working in medical cannabis. As a general manager, I did not say. I said that I'm just working in a healthcare company that works with specialists, but I did not say anything in detail. But now I'm very proud to say that I'm working in medical cannabis.
No, so that's awesome.
Good. You're a convert. We like that. It's every other professional that's working out there, we like to convert them because it really is, and you're seeing it firsthand. You're having the same experience that many doctors have, not learning about it at university and the rest, and then coming into the industry and just being wowed by the factor and the experiences and the anecdotal evidence that is.
We still do have a lot of pain specialists and rehab specialist doctors who are not so, I asked them to send me some of their blogs, some of their, for me to advertise them on our website, and they said, Dolly, we don't want to go out and about informing people that we work in medical cannabis. And I was like, why not?
I assume in some cases, either it's the stigma associated with cannabis and its recreational history, or perhaps, as I have been able to confirm with some pain doctors who are very vocal about, cannabis not being what everyone knows it to be, that they have themselves conflict of interest with, with existing commercial arrangements with companies.
I agree with you. And this is where, I don't know if you have ever noticed or covered anything to do with HIV patients. I and team were discussing this yesterday, that yes, we do have all types of chronically ill patients minus HIV patients, where if you know that the 6 areas, based on 6 areas, the cannabis was approved in Australia in 2016, and HIV was number 1. And you'd be surprised to know that we don't have one patient who's HIV. So basically no HIV patients, but results are amazing. They haven't tried it. Those patients do also have some nerve pain, and that's killing nerve pain. But yeah, we're not treating at the moment. So I would want to aware those patients out there, HIV patients, and the treatment is available. But I guess because they get better treatment in the hospital, that's not costing them much, and that's why they're not coming again.
It's the PBS subsidy plays a role, I'm sure, in price point, but It sounds though like the thing I really like about the work that you're doing is that you're really, you're not at all you're not at all bothered about really a patient's history or how complex their case might be. With open arms, you're saying, come talk to us. You can at least explore options with alternative medicine. Maybe just there's no harm in trying something new if you've been on something for years and it's only having limited efficacy. So I love that. I think that's great.
Yeah, look, I've worked in many areas, and I can say I've worked in orthopedic, cardiology, immunology, HIV, infectious disease, pretty much every organ, like I said at the beginning of this interview. And I want those patients who are suffering out there to come forward. Some of the patients are still shy. Some of the patients are still has that stigma that I don't want to try cannabis. It's wrong. So
we have definitely, particular older age groups who have for 50 years dealt with the war on drugs, kind of messaging from government. It's there's still a lot of stigma to work through, but
we do treat 5-10% of the patients who are in aged care as well. So, but again, I'd like to treat more patients on that side. Again, they're in so much pain. So if they can live their last few years peacefully, why not?
Absolutely.
Yeah.
And well, did you have any more questions, Mitch? I'm sure I'll have a few that'll always hit me after the episode.
I think the question that we always ask, or not always anymore, but a good question for this one, considering just coming from outside of cannabis and seeing the transformation yourself, is do you think we will get to a space where medical cannabis is no longer medical, it's just cannabis and we've legalized?
Tricky question.
Yeah, it is.
Well, look, Schedule 8, will still has to be medical cannabis.
Yep.
S4, yes, but I think S8 can never be without a proper, approval channels.
So you don't. So, for example, the fact that we have THC available over the counter in Canada and America, you don't think that can happen in Australia?
Well, I would say it might happen. I don't want to say anything just now, but let's say in 8-10 years, maybe. The reason why, because then, we would have many patients, using it for no reason. I would just go and say that, okay, well, I have a problem sleeping. Can I get it? So you don't want people to misuse it.
Yeah, that's very true. I see the experience of alcohol for this one.
And again, it's based on the research that Australia is doing currently. So it's hard to tell, right? I do get a lot of patients coming and not me, but the query gets sent to me saying that, I'm from America. I used to take this product in America. How much is it to get it? And I was like, okay, well, I roll my eyes and say that, well, it's not that simple. We have to go through proper process, and we can then see if we can help you or not.
And they're always like, what? You have to do all that?
Yeah. And pay for it.
Yeah, exactly.
Indeed. Well, thank you so much, Dolly. Really appreciate your time and your insights. And I think you're definitely the first person that we've had on the show who's really kind of taken us for a bit of a deep dive into what it's like to be, a part of a clinic that's treating some pretty complex cases. And we obviously applaud that because, cannabis medicine should be available for everyone, no matter how mild or severe your symptoms are. So we love that. We'll wrap it up there, but we'll keep in touch. We might even try and get you on for another episode in the future. But
right.
It's been an absolute pleasure chatting with you, and take care. We'll until next time, we'll speak soon.
Thanks, Dolly.
Thank you. Have a good weekend. Bye.
Bye.
Cheers.